I don't know if you want to talk to them about the valley fever doctor.
Oh yeah, yeah. There is a guy here in town who is a doctor. He's a surgeon in a local hospital, and he was what, about 45 years old?
No, he's about 32.
32 years old, and he got valley fever. Now, that's a lung disease, and he was really, really feeling bad and getting worse, and he was trying all things, and they were talking about operating on him. Well, as a surgeon, he don't want to be operated on. And so he heard about us, and he came over, and you tell him. You.
Well, it's a fungus that is on the lung, and when they went to check one of his left lungs, well, his left lung actually, they transmitted to the other lung. So they were talking about not being able to get rid of it. He went over with this almost a year and a half, and he was out of work. He couldn't go back to work. He was really sick. He was with no strength, and so he came to see us. And on the first, when he called me up on the phone, he wasn't able to speak. He kept coughing and coughing and spitting out a lot of phlegms. And he came in, and we gave him, I think it was 3 drops. We gave him 3 drops, and within an hour we gave him another 3 drops. And he didn't cough for actually an hour and a half. He went home, and he was okay. But during the night, he kept like throwing up a lot of phlegms. And in the morning, he took another dose, and he wasn't coughing anymore. And this went on for probably a week and a half. He went and got the x-rays, and the fungus had reduced already, and one of his lungs, he was liberated from this fungus. And within 3 weeks, he was back to work, and he's doing fine right now. He went out the protocol of 15 drops 2 times a day.
Okay. All right, what else? What else?
I've heard many questions regarding HIV treatment.
Oh yeah, right. There's a lot of people talking about HIV.
And versus AIDS.
And AIDS. Actually, we seem to get better results with AIDS than HIV. HIV, you can get it. It takes quite a while to really dig down into it, because HIV seems to go really, really deep in the body, and it seems to sort of go and hide a little bit. But if you really keep at it, keep taking it every day, and have a pretty good amount, work out to 15 drops, maybe twice a day, and then take 15 drops twice a day for maybe a month, maybe 2 months. Eventually, it seems to get it, but it doesn't go fast, and if you don't, and it will sort of come back if you don't get it. So you need to, and once you're convinced you've got it, you need to go have yourself checked to make sure that it's gone. Else you need to keep taking it. And AIDS seems to go way faster. And you know, we don't have a lot of evidence on AIDS, except my friend over and except what I did in Uganda. And a lot of people took it, and they all felt better, and in 3 days they wanted to go home, so we let them go home. You know, I've learned since then, that's in the book, but since I wrote the book, I've learned that some of those guys come back after 6-8 months, and they said they were feeling bad again. So we didn't have any way of checking them. We didn't have the money to run blood tests or anything like that on them. The only way we could check them was, are you feeling good or not? So that's what we did. We checked them, and they seemed to be feeling good, so they went home. And my doctor, the doctor I worked with over there, did all of this. I was a side stander, but anyway, then a friend of mine over in Africa who employs like 30 people, he had 5 people who had AIDS, and they were so bad off that they couldn't work. And he started them on MMS, and they're all back at work doing well, feeling good. Whether or not they have AIDS is another question, because again, the testing procedures over there for AIDS is not cheap. In Africa, it's just as much as it is here or more. So nobody usually gets much AIDS testing because you can't afford it. And unfortunately, they just go ahead and die. But these guys are all back working, so evidently it helps AIDS pretty good.
What kind of protocol did you use over there?
He started them on the standard protocol, which it's just starting off with 1 drop and then increasing to 2 drops and getting on up to 15 drops.
Once a day?
No, I think all he did was once a day. But the fact is, a person should go, when they're doing it once a day, then they should go to twice a day, and then they should go 3 times a day, and keep that up until they're feeling good. And here in the States or in Mexico, they should go ahead and be tested again to see if it's gone or not. Okay. What's
Hepatitis?
Hepatitis.
We got the experience from the county jail.
Yeah, we get a lot of, do we?
Yeah, remember that it disappeared in 4 days, hepatitis C?
Oh.
Hep C?
Uh-huh.
Hepatitis C got in the county jail, got cured in 4 days or disappeared. Yeah, that's right, they tested it there. Mm-hmm. And so that goes.
And they only gave them on the weekends.
Wow.
They gave them once or 2 times, and that was it.
Wow. Well, normally though, I've had a lot of people who have had a tough job getting rid of hepatitis C. So I have to do the whole protocol, up to 15 drops 3 times a day, and I have to carry it on for a while. Most of them have got cured.